Now, with a few notable exceptions, breakthroughs in medical technology have been the preserve of well-financed Western hospitals and research institutes. And that's what makes the emergency autotransfusion set, or EAT-set machine, even more remarkable. This potentially life-saving device is the brainchild of Dr. Ovadje, a colonel in the Nigerian Army's Medical Corps.
It is equipment with which you can salvage, you can blood from people usually, then that blood can be processed within a very simple system, and then can be given back to the patient concerned, so that you don't need to buy blood from the banks. You don't need to transfuse Mr. A with Mr. B's blood. In this way, we'll be able to reduce the spread of blood bonding.
Blood transfusions are among the most essential services offered by modern hospitals. But with the AIDS epidemic taking an unprecedented toll on the continent, transfusing blood can be a dangerous game of Russian roulette. Transfusions of blood carrying the HIV virus will infect the patient with the deadly disease, and huge questions hang over the screening of donated blood in many African hospitals. But by using the patient's own blood, the EAT-set machine takes all the doubt out of life-saving transfusions. The inspiration for the EAT-set machine came from Dr. Ovadje's experience in the army, where battlefield wounds can cause excessive bleeding that makes transfusions critical. But this is one military technology with huge benefits for civilians as well. It looks certain to become a crucial piece of equipment in hospitals all over the world, but particularly in developing countries, where blood is often in short supply or at risk of infection. Already, word about EAT-set is spreading among patients and doctors in Nigeria.
There's going to be a large demand because quite often doctors call me, across the country, asking me how they can get the EAT-set.
Although, like any good doctor, patient welfare is his first priority, Dr. Ovadje is proud to have received recognition for his invention. He was honored with an OAU gold medal and was declared the African Scientist of the Year in 1995. All of which should add up to a lasting contribution to the health and welfare of people in need of a critical blood transfusion.
This is an emergency, a case of ectopic pregnancy, and the patient has lost so much blood due to internal bleeding. She needs a surgery and a blood transfusion. She's getting both. Unfortunately, the blood she's receiving is the very blood she had lost. This is made possible using an equipment called EAT-set, Emergency Autologous Transfusion Set, invented by a Nigerian Army doctor, Colonel Ovadje.
A pregnant woman with ruptured ectopic gestation is being intubated at surgery by the anesthesiologist in preparation for surgical intervention, arrest of bleeding site, and salvage of blood from the peritoneal cavity using the EAT-set. The patient is being draped by the surgical team and the nursing team in readiness for surgery. The patient has been properly draped by the surgical team and the nursing team. The EAT-set is brought in from out of its sterile pack and prepared, giving the suction tube to the surgeon, while the anesthesiologist or the transfusionist takes control of the pumping unit. A nip at the peritoneal membrane just to create a space to let in the suction limb of the EAT-set, which has been introduced, as you can see, with blood flowing on the line through the manipulation of the manual unit, blood is now being sucked into the reservoir, the heat set reservoir. And as you can see, blood is rushing from the peritoneal cavity into the heat set reservoir.
1 minute, we have almost finished.
Being collected from the peritoneal cavity into the heat set reservoir. And in this way, as much as 600 mils of blood is collected in less than 1 minute. Gentle application of the suction tube into sites of into bleeding sites, you can collect as much blood during surgery using the heat set. You can see how the surgeon assistant is poking around the bleeding sites to collect blood. Pressure on the peritoneal cavity, a pressure on the heat set is gentle and suction is gentle. It is where you reduce the vacuum pressure and prevent further lysis of the red blood cells. You can see the pressure on the system is gentle while the suction process is gentle. This is to create a low vacuum and reduce further lysis of the red blood cells. The surgeon gently secures hemostasis. The surgeon gently secures hemostasis. Over 1.5 liters of blood is collected, and this is being handled to the anesthetic assistant, who will further put it up to be transfused or reinfused to the patient. You can see how full the bag is. Over 1.5 liters of blood has just been collected, which will be given to this patient. The patient's blood is the safest blood. This patient will take his blood, her blood, and will no longer bother as to whether the blood given to her from the laboratory could be HIV infected or carrying any other blood-borne infection. More blood is being collected. You can see the hand, the moving hand of the surgeon assistant, poking around all bleeding sites. After 1.5 liters has been collected, which you can see hanging up there, the surgeon is not done yet. He's still collecting more blood. The heat set. The blood salvage device, relevant to the needs of developing countries. You can see the surgeon's hand poking around all areas where blood is collected, all bleeding sites. In this way, you can save as much blood. That could be more than what you routinely give to patients during surgery. You can see Dr. Thompson continues to look for areas of bleed and apply the heat sets. More blood is being collected.
Are you seeing?
Gentle pressure on the manual pump
Are you seeing?
leads to continuous suction of blood from the site of surgery. You can see the surgeon's hand saving as much blood for the patient. Scavenging for blood is one of the techniques of trying to get blood for the patient. You can see the surgeon collecting blood, scavenging for blood, poking around the bleeding sites.
Are you seeing that? Dr. Coffey's hand.